Everyone, welcome. We did it. Thank you, folks. Okay, good afternoon. My name's Brian. I'm one of the ROSC coordinators from Cuba. Actually, let me go ahead and get the presentation set up. And I'll tell you what, while I'm getting the presentation set up, we're going ahead and do introductions. And we will start here in the room with Valerie, and we'll go around the table. Then we will get you all of my friends here on the internet. We'll get you guys introduced right after that.
I'm Valerie Rashi. I am with the Leadership Center at Chestnut. Here to support you all in Hi, I'm Jamie. I'm also with Chestnut.
David Knowles with Hearts United.
I'm Magnuson, Litchfield Ministerial Alliance and Deacon Church here in town.
Lee Stone, Recovery Care Coordinator from Rehab. Lindsay Miner, Recovery Care Coordinator from Montgomery County.
Hey, Brian, Park.
Be the president of St. Francis.
Kevin Schott, Director of Montgomery County Emergency Management.
From office, just recovery.
We're using a mobile hotspot. I'll go down. You'll have to, because it's wireless. Not reliable at the moment. Sorry about that.
Hi, I'm Donna Alec. I
We're
am
working on it, but it
with
won't be done in
General
time for you.
and with the
Okay, thank you.
I'm Chris Smith. I'm with Hi, everyone. I'm Julia Butler. I'm with James University and I'm project coordinator.
Hi everyone, my name is Becky Hadley and I'm the health program coordinator for Cooper County Public Health Department.
I am Carissa. I'm faculty over at Kitlos University School of Medicine. Probably also want to keep people on the phone.
Yes, we're getting ready to do that. Okay, that's everyone in the room. How about, since I'm looking at Tony on screen, Tony, could you start us out by introducing online? And can you hear us all okay?
I can hear you. I'm Tony Randall, and I'm from the Bond County Recovery Council. We work on the ROSC grant in Bond County.
I'm Angela Holloway. I'm from Chestnut Metro East Recovery Council.
I'm Beverly Holland. I'm also with the Metro East Recovery Council.
I'm Deb Beckman. I'm with the Take Action Coalition of Clinton County.
I'm Jason Farley. I'm with Amare, Recovery Community Organization in Wood River.
I'm Nancy Phillips. I'm coordinator of the Illinois Family Resource Center, and I also have the honor of being the ROSC coach for this group.
Good afternoon. I'm State Senator Doris Turner, and I'm excited to be on. Blake Meyer from my staff is also on, and he has been participating on a number of healthcare related roundtables throughout this process.
I am Amanda Ross from Carlinville Area Hospital Emergency Department Manager.
I'm Ovia. I'm a practicum student. I'm a Coupon County Public Health Department.
I'm Ailey. I'm from Net Community Church and also the Staunton Helping Hands Center with Celebrate Recovery.
There you go. Okay, and
Blake, did you introduce
Blake, did you introduce yourself?
No, I did not yet. Hi, everybody. I'm Blake. I am usually here. I'm usually able to be in Litchfield for the CRC meetings, but I was happy that I was able to make it to the ROSC meeting today. Like Senator Turner said, I'm with the staff there, and I am also excited to be here and get some good knowledge about what's going on in the district.
Very good. Okay. I think that may be everybody. We can hear you fine over the laptop computer. We're trying to get you in the speaker, in the room speakers.
There should be an audio cord to some degree.
It recognizes that the computer is there, it's just not.
All right, Brian, you maybe want to just.
Yep, we're going to keep going though. So, okay.
I'll mess with this. You can call it.
Okay. So, there we go. So very quickly this morning, hold on. I think we may be. Okay, folks, online. Let's see what we got. We just found something.
Somebody say something. Somebody say something, please. I see you, Nancy. I see you, Nancy Farley at Amari. Can you say something? Can you hear us?
I can hear you. I can see.
I can hear you.
PowerPoint, share screen.
Okay, so anyway, thank you, Jason, I appreciate that, but we're just quite not there yet, so I'm going to keep going with the meeting. So our presenters today is actually myself. Becky's here that you met. Kent is not here at the moment. And Tricia, we'll have exciting news next month about the clinic, and Tricia is working with that today. So I guess first thing I'll do is go ahead and you all had copies of the minutes from last month's meeting. I was going to see if we can get those approved. So I'm doing approval of the minutes. Does anyone second? Okay. Okay, meetings are approved. Okay, thank you. Announcements wise, we have some couple webinars coming up. Evidence-based strategies for preventing approaches to substance use and disorder on youth. Three others. Basically what we try to do is every month with our minutes and with our announcements that we put out via email, we put out some webinars. They're always free, usually dealing with topics that kind of relate to the work we're doing. We are continuing to collect data for our PIMS report. We'll be doing that through today, and then our next report is normally due in March. They did put it off for a few months, but we'll still work as if.
But still, we need the data
Yes.
going up to the end of February. So essentially, it's better to start working with us as soon as you can.
Yes.
If you're one of the folks that gives us PIMS data.
Please do. And the meetings that we help support are both doing well. That's our Al-Anon meeting Thursday night at 6:30 at Crossover Ministries, and Emotions Anonymous meeting every Thursday 6 to 7 at Beacon Church. And Linda, I do see it is crossover. I will correct that for next month. Crossover is an action word, 2 words. So,
And you will like it.
and we will like it. So if we could have maybe a 1 minute report, 1 to 2 minute report on safe passages for the month, Lindsay or Elise.
Well, our safe passage program is.
Try to speak loudly so that people don't hear too.
Sure. Right now, I don't think we've added any new access points past Staunton Police Department. We have scheduled 4 city council meetings through March, April, and May to discuss the programs that are in Carlinville and Montclair. Now we're doing good with the program. Keep going.
We got 3 safe passage calls just this
Well, we
morning.
did, yes.
Yes.
The program is going strongly, but we get a lot of safe passages.
Yes, I don't know if you folks heard, but the Safe Passage program is really a success in the area. We're up to 18 access points in the 2-county area. We had 3 individuals alone. Monday mornings, we tend to have stuff like that happen, come through looking for help. So yay, and again, we support any other town that would like to start their own safe passage. I believe there's a conversation that may be occurring soon with someone in Vandalia to help the program get started there. St. Francis Way, things are going well. We will go further probably into next month. The outpatient program with the Macoupin County Public Health Department just did some tweaking that should open access to people seeking help much easier at more times of the day, at more days of the week. It goes into our philosophy that we're really trying to meet people where they're at when they're ready. Okay, we have on outreach and awareness, we have a couple billboards up now in the area. There's our Recovery is Possible. Again, next month we'll have a new surprise. There will be some yard signs. Thank you, Merck, for that idea. There'll be some yard signs we'll have available to pass out. And Becky, yes. Deb,
Little thing. There
you go. Sorry, had to move you, Deb. So, and these are yard signs. We'll be having 100 of those available in the area. And as outreach and awareness overall, Lindsay, Elise, and a little bit of myself, our engagement with the community is just exploding. We have what we call a referral partner spreadsheet. And if you look at that, last week alone, we had 48 engagements with people in the community, building bonds, building relationships to make this thing really work. So, and then again, if you come back in March, this is to get you back. If you come back in March, we're going to have some pretty big news coming out. That will be in the agenda that we'll release in a few weeks. So, and that ties in with our ROSC, which we are very grateful for the state of Illinois to be working under this grant to expand the network of services for individuals seeking assistance. And because we have a jam-packed agenda, that now brings us to our speaker. This is Donna Nalick. She is with the Merck, and she is a partner in the Regional Leadership Center for the ROSC in Illinois. She has been working with our very young ROSC to help us grow and develop, has been a great asset. And recently, under her leadership center, she was up here doing some key informant interviews and kind of looking at the needs of our area herself. And I thought this is a perfect lead to bring someone in, let them talk about what's going on in our area and what is needed. So without further ado, I'm going to bring you Donna Nalick, and I'll let her come up here.
I appreciate you, and I must say, I did not authorize you to do this picture. I don't know where you
Thank you, Donna.
It's stuff on the internet. What do you do?
Right? That's on my LinkedIn. So I think I know where he got that picture. So, you know, I want to talk to you today. I don't know who's running the, do I click here or is somebody else?
All yours. You can just click. Yep.
Okay.
You want to go out there and you just tell me later.
So, yeah, because I like to roam around.
Sure.
This is too much
Go for it.
standing for me.
You just tell me next slide and
So I will do that. So, I am actually part, and I'm serving as the site director for Boston Regional Leadership Center. So this is separate from the ROSC project that we've all been working on. This is a separate project. And I'll talk to you a little bit about that. But what we're going to talk about today is really some work that we did. And this is primarily around Montgomery County, but please know that a lot of the same information, and we are working also in Macoupin County. There's a reason that we're specifically focused on Montgomery. So this is just me, if anybody wants to contact me ever. All right. So it's a big job, right? What we all do is a big job, and it always seems impossible until it's done. And that, of course, are not my right words, but Nelson McDonald. Okay. And sort of the who, what, when, where, and why. Why are we up here? Why do we do the work that we do? And how sometimes it feels like we're spinning our wheels. Like the work doesn't get done, it's too big, it's too much. And what we were tasked with doing was really looking at what are the needs of this community? And then how can we help you develop a community action plan to work on that? This is not incumbent on anybody else to do that, but it's your community looks different and your community action plans don't look different. And again, these are not my smart words, but somebody when I first started at Chestnut almost 15 years ago now, I sat in on a training and it was around community work. And what they said was every single community is specifically designed to get exactly the results that you're getting. So if you want different results, you got to change what you do. You got to change communities. Okay. So this leadership center at Chestnut, we're one of 5 leadership centers in the state. And this 33 area blue section is the area that we were tasked with working in. So specifically, what we were asked to start with were those 15 low access counties. They call the state designates a county as low access if in their perception folks don't have enough access to specifically medication assisted recovery programs. And this designation happened before all of the cool stuff happened. Yeah, so that's sort of where some of that came on. Yeah. Okay. So before we start talking about some of the gaps that we saw here, I want to share just a little bit of data. Now, please know that the data that I'm going to share today is just a very small portion of what we shared with the state and what I shared with Brian and anybody else who wants this data. It's not collected so that it can sit in somebody's file. It's collected so that if you at Hearts United are writing a grant and you want to take a look at, you want to use some of that data to write a grant application, absolutely, that's what it's for. It's for community. So one of the things we are going to look at is this county health ranking data. I don't know how many of you, those of you who work in a health department, look at these all the time. But for Montgomery County, their health outcomes rating is 75th out of 102 Illinois counties. So that puts you in the lower 25th percentile. Okay. When you look at, and there is so much data on this website, but when you look at a couple of the things, I just pulled a few that I thought were very, very interesting. Specifically, look at that ratio of population to primary care and to mental health providers. And look at the difference between Montgomery County residents and those statewide. Right? So then you start to see why we get some of the outcomes that we get. All right. So another data piece that we look at, and this is where my world is we look at a lot of Illinois Youth Survey data. I wanted to share this with you because it's also going to show up as a gap later on. We only have 8th grade data because not enough high schools took it to be able to share the data. So you have to have more than one high school take it so that you can share county-wide data. Otherwise, you're specifying that you're sharing confidential data from one high school, right? So of our 8th graders, their 30-day past use rate includes this. And the reason we use 30-day past use is because that is considered the best indicator of what kids are actually doing. If you ask them, what did you do in the last year? What did you do? Have you ever? You get a little fluffier data. It's better to always ask, what have you done in the last 30 days? So take a look at those vaping numbers and the alcohol numbers for 8th grade. Not only that, but 40% of Montgomery County 8th graders who participated in the survey in 2020 also indicated that they had felt so sad or hopeless for 1-2 week period at least that they stopped doing their usual activities. That's an indicator of depression, right? 40%. Right? I'm not saying And you guys, this is what we're seeing in the area across the board, not just Montgomery County, right? But it is important to know. Okay. For some adult data, we have some really different data sources here. We wanted to make sure that we talked to the coroner's office. We looked at the IDPH opioid overdose reports, and then we looked at the IDPH dashboard. So in 2021, there were 12 overdose deaths. Every single one of those involved fentanyl. Some involved fentanyl and meth, but every single one involved fentanyl. Okay, the opioid and the Illinois overdose rate, if you go back to that, the Illinois rate is about 23. So for that 23 data point, well, are over the Illinois rate for deaths per 100,000 population. Okay. Community voices. Here's what some folks in your own community said when I spoke to them back in November, always asking, of course, if I could share what they said with other people. And I'm not going to read these two. I think if people do that, you won't know how to read. Right? Okay. More community voices. Okay. And then this one, go back to the one just before this, Brian. So this person said to me back in November, I've been out of residential treatment for 1.5 weeks and I don't know where to go or what I'm supposed to do. I think about that person when I look at this next slide, because this is how people feel, right? That person standing in the front is hoping to get to that magic place in the center where they feel better, right? And look at what they have to do. Okay. So before I start talking about some of the gaps, I also want to share some of the very good things you guys have going on, some of your resources. And I want to start out by saying I missed you. Okay, I missed Crossover Ministries, and I will put that on the slide. I apologize, and I missed your 12 steppers. So when I was typing things over here, and let me know how to write that. Is it crossover? Yes, it is. 2 words. I work. Make that happen. But I also want to talk about good stuff. You got good stuff going on. You got people who care a lot. Okay, but we are here to talk about gaps. So we're going to talk about the gaps across the continuum. You'll hear us say that. Those of us who work in this field talk about the continuum. And sometimes people look at me and I have to remember that they don't know what that means, but they, we don't work with it every single day. But the continuum of care starts over here on the left with health promotion. What do we know about our own health? Right? We move into prevention, move into harm reduction, intervention and treatment, and then recovery. So we're going to talk about the gaps that were identified across this continuum of care. So gaps in health promotion. In Montgomery County, there is a general lack of understanding about substance use and addiction, which leads to an increase in stigma. Right? I heard it over and over and over again. Quote from someone I interviewed. Go back one, would you? Quote from someone I interviewed. Many people, unless they're directly or indirectly connected to someone who uses drugs, think of it as a moral or ethical choice, and that someone should just be able to stop. Yeah. Right? Okay. So gaps in the prevention world. There's a low rate of schools participating in the Illinois Youth Survey. If we get more data, you can apply for more grants, you can get more help for kids. It just is what it is. But we have to start and we have to work with our schools to get them to take the survey. The survey window is open right now. 2022 is a survey year. I did not look, I meant to look today and see how many schools in Montgomery County were registered. I can probably tell you there's 1 or 2 that probably are because they've been very good about taking it. But we got more schools and we need this data. So that's one of the things I want to talk to you about when we're talking about community solutions is who knows somebody at schools. and can get folks to sign up and take this. Okay, there's also a general lack of understanding regarding the impact of trauma. This came out multiple times, multiple stakeholders talked about trauma and how when people come in for any kind of service, the first thing they need to work through is their pain around all of that trauma before they can ever talk about behavior change, right? But we need to, as a group, and I would say even some of us probably in this room don't fully understand the scope of what trauma does to a person. Okay, trauma is infectious. It is the gateway drug, according to someone in your community, right? Okay, so gaps in harm reduction and intervention. There is a lack of awareness regarding the availability of Narcan and safe syringes. And there is stigma toward both. So people have shared. If I could, because those services are available, I'll tell you that. If I could get safe syringes, I don't know if I would, because what if people knew or found out or whatever. Okay. Now, great news. We recently, Chestnut is the top provider of Narcan in this county. And so we recently got a community volunteer who is helping distribute Narcan to anybody who needs it. That's a whole lot better than having to go and, 40-minute drive to Chestnut or us coming here and then there's a delay, right? So we have someone in the community who is willing to distribute Narcan. They would be at St. Francis Way Clinic if it has Narcan that we provide. So if there's any other of you who say, you know what, I could probably use Narcan in my place, yeah, we can make that happen. Okay, there's a general feeling, then there's stigma toward that Narcan is enabling. Folks, I've heard this.
For awareness, our doctors, Litchfield family practice and practice, they will prescribe Narcan if you're ahead. I used to know that my son is dead, so they gave it. He has Narcan.
That's great. So there is a feeling among some, though, that Narcan is enabling. I've heard this from professionals, not in this community, but in another community, that they themselves felt like Narcan. And I was, of course, flat affected and trying to say, well, let's talk about why that's not really the case. Okay, so gaps in the treatment system. And note that some of these things we're not going to be able to fix. And you're not going to be able to suddenly magically bring a local detox or residential facility here. But maybe we can figure out a system to help our folks get to those places. And that's important as well. There's lack of internet access for some residents. So why is that important in treatment? Because they can't get there and they also can't do telehealth. I think this county, it was, I've read so many county reports, 25% of your folks don't have access to broadband internet. And then a big one, lack of reliable transportation. This is huge. You're going to see it on the next slide as well, because it was mentioned in both things. It was mentioned both for treatment, you can go on, right? It was also mentioned in recovery supports. Folks, there are a couple different problems. And I apologize to those of you who are just hovering behind, I'm sorry. But folks can't get to treatment that may be an hour away or detox that may be an hour away. We have looked at multiple transportation systems. We look at what bus systems, we look at how much they charge, we look at how long it takes. One transportation system that was providing, so on paper, there is provision, but they were charging $1 a mile for anything outside the county. How does that help anybody? Right? It's available. It's cost prohibitive for some folks, right? And then you have folks who are just saying, look, I can't get to a recovery meeting, so I can't get to my first call. One of get some people and then we give each other rides and take care of each other, but I can't get to those first couple. And what might be 5 minutes down the road might as well be 50 if they can't get there, if they don't have a car, right? Okay. So people mentioned, go back, Brian, I'm sorry. People also mentioned a lack of secular recovery support meetings. So smart recovery, things like that. There were plenty of folks when I did some focus groups with some folks with lived experience, and that came up several times. The need for something. The 12-step groups are fabulous, but there's also a need for something else. And then, wow, lack of recovery housing or local housing options. So not only do we not have access to a recovery, an official licensed recovery home, there are also not options for some folks. I heard this loud and clear when people would say, okay, but because I have a drug offense from 6 years ago, I can't get a place to live. It was a non-violent offense, but I can't get a place to live because it's on my record. If there's a waiting list, who are they going to rent to? Not me. Right? So we're looking at some of that. Okay. So these 3 gaps were identified across all of the counties, all of the 15 counties that we looked at. And these 3, then we have developed some work groups around, and we have met with folks from transportation companies. We've met with folks from Oxford House. We've met with, does anybody will talk to us to really start to brainstorm some ideas. Okay. Yeah. Here are some things, here are some starting points. And what I really want from you all today are some other ideas for things that work here. So under recovery housing, we're looking at what are other states doing? Is there a potential for housing for drug court participants? There is a state, a county, Christian County, not too terribly far from here, right? Where they got a grant from a local hospital to provide housing for folks in their drug court. Brilliant. They just started like a month ago, right? Right. But those are the kinds of things like we want to bring that kind of stuff back to you guys and say, how can we make that work? Right? Then we're going to work on, hopefully down the road, a toolkit for landlords. So if people have questions, hey, I am interested. I would love to help people out. I'm interested. Sort of, here are the things you have to look at because the devil's in the details, right? And people get freaked out when it's so big. So we're trying to help them break that down. We've been talking to Oxford House. You all know Oxford House has population requirements and they have there has to be not a big enough population, but there have to be employers.
I bought me a hamburger and I just wanted some French fries.
Or not a match for an Oxford. When it comes to stigma, Valerie.
Yeah, like French fries. I was just gonna cut it around
They're, are there education?
You know what I did? You got me so hyped on noodles. My aunt told me that they had the chicken quarters on sale. So I went up to what's that? Looks. Got me some salmon. Damn chicken noodles. Oh, okay. Oh, I got to go around and some damn noodles. Oh, dang.
Hey, somebody needs to mute their phone.
Okay, this is a good time. That was my last slide. Other than we're going to And what I did was I just included on here every single route that showed up from Montgomery County. And I want to hear from all of you so we can have a conversation, but I know some people think in, let me write it down. And some people want to say the list, right? You guys can
fill it in and all.
share with us. What are your thoughts around?
I'm stop talking to you and my aunt because y'all had me just, oh, I lost all the weight I lost. I be damn engaged.
Angela, could you mute yourself, please? Sorry, Donna.
That's okay.
That wasn't me.
First of all,
I'm already on.
Yeah, please. No, we can hear you talking in the background, Angela. I'm sorry.
I can share those with you. I can also share that full 12-page document. I get all jazzed by data, but I don't want to assume that everybody wants to read that.
Oh, yeah, for when we're running grants. What was that website that you put all those stats from?
Oh, there were so many.
Okay. We're digging into some of our old, just look at the slides. I'll take this.
Yeah, the Illinois opioid dashboard is one. That's a fabulous thing. You can always just call us because we are data nerds and that's what we like to do. So if you need any help with that, that's what we're here for.
I'll take the slides first. And we'll
Yeah, we can do that.
Awesome.
Okay, any other questions about data or?
One of the challenges, I don't know if it's entirely Montgomery County, but we really don't have any enforcement here on what a rental property is like. And so a lot of our people have to move into places that are deplorable and charge high rent. So I think we need to take into consideration, you know, that something big. Okay, which just look like higher coverage.
Well, and that's everything feeds into. I'm going to move here so that I'm not hovering behind you for awkwardly. Everything feeds, right? So the stigma feeds into the transportation issues because even volunteers are like, I'm not sure I want to do that. You know, what are those people going to do? And then it surely feeds into the recovery of it, right? Other questions? But things that we're looking at from the state, like I've even asked the state, okay, you have litigation pending around, not litigation, wrong word. You have legislation pending, around tax incentives for employers to give jobs to people in recovery. What about if you just tacked on for landlords to rent? I don't know any of the what's necessary there, but those are the kinds of big ideas we're trying to throw out so that we can start this.
It's interesting. I want to go back to what Linda was saying because I know at Hearts United we try and help those with rental issues. And one of the things that we ran into a lot of is during that time when the landlords were restricted from evicting, even though there was nobody paying rent. And so after that was lifted, a lot of the landlords are trying to catch up or make up for the loss of revenue through that time. Even though some of the government still gave them money for it, they're still grabbing for more. And so they're not investing a whole lot into their housing. They're just taking money and trying to do with whatever they want out of it. And so that's not slamming on all landlords. We do have a list of landlords that we work with, and some are actually trying to provide for those even with corrections to so there's some that are doing it, but there's still a lot that are still using the system in that way. So that's kind of sad. That's just something that we need to look at, see what we can do.
100%. One thing that I do want to ask all of you is if you're interested in continuing this conversation, we're going to be holding some just Zoom type meetings, which is just brainstorm some more. Because we are writing reports for the state, and part of what we're asking them to do is let us continue to work on this. Let us continue to build toolboxes around stigma, to try to work on some things with landlords, to try to work on some things with transportation. So if you are interested, if you would just write your name and contact information on the top of that worksheet, jot some notes, whatever you might think about any of those things. We're collecting all of that, we're compiling all of that. All of this data, all of this information that I shared today was gathered from Montgomery County data and from Montgomery County residents. None of this is me surmising anything. Any other questions, comments, great ideas about one of the staff? Sir.
I don't know if they're still on. Senator Turner and Blake from her office, works over in Collinsville. We're on. Please, I'm not trying to throw you under the bus, but we have a conference call with Senator Turner's office every Friday, our emergency management people. We have a few people that participate in. We have a community risk reduction committee here in this county. Senator Turner has been extremely interested in everything, as well as Blake. What you're talking about is going to take some legislative action.
Yep.
And I participated in a health roundtable with Senator with a relatively large group. Perhaps, here, I'm not throwing you under the bus, Blake or Senator Turner, if you're still on, but perhaps we could do a roundtable with her. Very good. To get some interest, some legislative interest behind us.
Amen.
I would be very interested. I would be very interested in doing that. As a matter of fact, that was one of the reasons why we instituted the roundtables, is so we could hear from the community and then be able to take those issues and concerns forward. So we just finished our first round, and we're getting ready to start up again. So can you just work with Blake, and Blake can get that started and up and going. And we really do take everything that we hear and see from not only the roundtables, but those weekly calls that we participate on. I know at one point there was some mention of Senate Bill, I think it was 3734, and I was not familiar with that piece of legislation, but after the call, I did do some research on it and jumped on very quickly as a chief co-sponsor. And we have several bills that I was actually ushering through the General Assembly regarding healthcare. The one that we just sent over to the House, I believe will go a long way with providing some access in our rural communities. So for those of you that don't know, I retired from the Illinois Department of Public Health. So health and access to health is definitely not only something I'm interested in pushing through the General Assembly, but it really is a passion for me. So whenever I can be helpful in any way, I'm more than happy to do so.
Thank you, Senator Turner.
So,
okay.
Brian's giving me the wrap it up signal, but I am very, very interested in what you all have to say. So I would love it if you all would take some time and jot some notes down. You can always send this back to me, get it to Brian or some of the other folks at St. Francis, and they will get it to me. We're in contact all the time. What this is about, I'll just finish it here. What this is about is promoting equity in rural communities, so that folks in this community have just as much access as folks in any other community, right? And so we want to make sure that we're doing our part, and we're here to help. So.
Okay. Thank you, Donna. We appreciate the time.
I'm just going to go really fast because we don't have very much time. So just the announcements, the Macoupin County Public Health Department did finish out its own needs assessment. We don't really have time to go through that right now. So one of the things that we are going to be sending home with you, though, is a little bit of homework. we're gonna be turning in the needs assessment we have, but we would want to get feedback from the council on that. So, if you could look through that, kind of look through some of these questions and give your feedback back to Brian, that would be great, and we will incorporate that into a revised version of that report. So you'll see that there'll be a concept mapping thing. This is sort of an idea of what we are thinking in terms of how we want to do services. There'll be some general questions, and go to the next slide.
Thank you.
Some general questions to ask, just some things to consider. And you don't have to like answer each one, just, just send them an email with what you think. And so what's this next slide? And this is basically, what do we basically have as potential categories, potential needs. So if you want to fill out the sort of worksheet and think this through, what this map should really look like, that would be great. If you are happy with what it is, just say you're happy with what it is. But this is sort of your idea to kind of get a little bit of feedback on. The next slide is, don't forget to send PIMs for all those that need to. I think that's it. And now we have whoever is going to give it the moment of silence.
Don't do it real.
Of what? Of the needs assessment?
Yes.
I was
going to.
Oh, you were going
Yes.
to. Oh.
Okay. So folks, yes.
Can you explain what PIMs are? So the PIMs is basically for those people who are part of the recovery, the Rural Communities Opioid Response Program Consortium, and those who have started, who became part of that, they've agreed to help share their data on referral patterns, so we know who is getting referred and how many services people are getting and who's going through our system and who's not. We don't identify people, but we just get numbers, raw numbers on how many people are getting served. And so that's really what the PIMS is. So but generally, if you know what PIMS is, then you're supposed to be giving it to me.
You'll know it.
Okay, I just want to take a moment, thank everyone for being here today before we close and have our moment of wellness. And I just want to tie it all together. It's like, what is all this? Because I know some of you guys, this is your first time here with us today, and basically comes down to this. The state of Illinois has charged anyone around this table with a goal of looking out there, seeing what's out there service-wise to help someone get recovery, maintain it, and to lead a healthy life as they define it. We're not here to shove our ideas down anyone's throats. In that process, we're in our first year building this. What we're doing at this point is we came up with protocols, membership protocols, ways to communicate, kind of what we're going to do, outreaching the community to kind of find out, to get a better idea of what's going on. The needs assessment that we're turning in tomorrow is actually this goes back several years when we started another grant through Macoupin County. We looked at what people were saying about the idea of substance use disorder, substance use, and what we've done since then and where we're at now. This is our first big needs assessment. It's not going to be perfect, but it's going to be done. Moving forward, we're going to be continually surveying the environment, seeing what's out there, what we can do. There are not enough voices that can ever be around this table. If you came here today, I hope you come back. When all is said and done, which means our work will never be done in actuality, we will have a good connected network of people, places, and services for individuals seeking recovery, for their family members and loved ones, and for our community as a whole, because that's kind of what we're down to do, is we're trying to make this a better area. It's a good area. There's lots of good people, but there's still stuff that can be improved upon. And so that's kind of why you've heard all these numbers, you've heard assessments, we want this data, want that data. The data helps guide us in our next steps of what we're going to do. Now, after we get this done, we will have until September 1st to come up with our strategic plan for the area. I'm looking for input. I'm looking for data. A good plan comes from good input, good data, and good people working together, which I think you all are, and I'm grateful to be with you. And now for our moment of wellness, Dave Knoblick will be joining us. And yes, so, and Dave is a pastor with the Assembly of God Church in Coffee, and he runs Hearts United here in Litchfield, a pretty major organization. So Dave, take it away.
So one of the things that I always hear and I always love is the unity that we all come together, organizations coming together to work for a common goal. And one thing that keeps coming to mind, and it's been kind of on my heart lately, is let's take this back to just a personal level. The fact is that organizations, we're coming together because we can't do it all alone. Well, on a personal level, and for those that have gone through and are struggling with recovery and are dealing with addictions, they understand finally that they can't do it alone. Well, it's just like us. Even if we're not going through a recovery situation, guess what? We can also admit that we can't do it alone. So relying on your neighbor, your friend, a mentor. Ooh, that's a word that a lot of people forget that it actually means a lot, is to actually have a mentor, regardless of what position you're in. You could be the president, CEO of the hospital, but guess what? You could have a mentor. Pastor that's in charge of the whole state. You could have a mentor. Any question, any position in life can have somebody that they look up to give them understanding that they don't have to do it alone. So let's remember that. Even when we look at those that we're trying to help, think about yourself, think about your own situation. You don't have to do it alone. So that's my moment.
Thank you, Dave. Okay, folks, thank you everyone for being here again. We will be meeting on the 4th Monday of March, which will be March 28th. So everyone, have a great afternoon. Oh, thank you, everyone. March 28th at 2 p.m. We would love to have you all back. If you have any input from the day or anyone online, if you would please have any information you'd like to disclose, feel free to send it to us. And have a great day, everyone. Thank you all.
Thanks, Brian.
You're welcome. Have a good day.
Thank you.
So if anybody has those worksheets that you want to
Thank you,
share
Sam.
with us, you want to share with us, or otherwise, if you want to give them to Ryan at some point at a later date, that's awesome too.
Okay.